Welcome to a training session from Drink Drug Hub. It's the place where you can get the right information about drink and drugs. It's run by North Yorkshire Horizons and it's available at that web address there, drinkdrughub.co.uk. It's where you'll find videos, guides, resources all about drink and drugs, as well as live training sessions and recorded sessions like the one you're attending today. This session is module 2 of our alcohol course. It's called Getting Drunk. And in this session, we'll be looking at what we mean by alcohol misuse and the difference between that and alcohol use. We'll look at how the brain's affected by alcohol and also the liver. And then we'll look at how any reduction in alcohol use benefits your health and an introduction to addiction and dependency. So this is where we're going to start. And this is actually tying into an earlier session, looking at dependency rates for people who drink. It works out at somewhere between 1 to 1.5 in 10 people who drink become dependent on alcohol. And we label this as alcohol misuse. And one of the questions we've got is about what do we mean by that and how do we define it? So what we can do is put that into Google and we can click on the tab for images and we can see what Google thinks alcohol misuse looks like. And when you do that, you'll get images like this. They're all of people in really extreme positions of feeling distressed or desperate or in pain. You would not struggle to perceive these people as struggling with alcohol use. And the other thing that's important and really interesting is when we did a test session with people who had alcohol issues, who reviewed this content, they pointed out that these were all men. And some of those people in the audience were women. So they said that might be another perception that isn't necessarily accurate. But one of the big things we want to point out here is alcohol misuse doesn't necessarily look like that. One of the most harmful things about it is it often actually looks like this. And the distinction between alcohol use and misuse is often grey and unclear. So we ask this question, how can you tell the difference between alcohol use and misuse? So we could say it's about how much you drink. So if you don't drink too much too often, that's okay. But if you drink a lot, and particularly to the point where you're getting heavily intoxicated, that's not okay, and we could label that as being misuse. But there's one problem with that definition, and we can see it here in an article from the Mirror. The Mirror is reporting on a comedian called Rob Copland who every Boxing Day sets himself a drinking challenge to see how much Boddingtons he can drink within 24 hours. His maximum was 12 pints and here he is trying to beat that with 15 pints. He calls it Bodmas. So this is him at pint 6 and this is him at pint 12 being served it by his dad. He's definitely drunk by this point. So what's really interesting is the reporting around this wasn't scaremongering or horrific. It was actually seen as a very humorous thing, and if you look at his tweets at the time, he is a comedian and they are pretty funny. So we don't see this necessarily as being a terrible thing to do. And then we have another article from the Mirror. This is one of a man who got so drunk he replied to his own text after a night out. These were his texts. He was basically returning from home. Then he asked himself whether he was in town and he replied to himself saying he was at home. Somehow this got into the Mirror and actually it caused quite a lot of humour. As we can see, people found it really funny. So this person on Twitter was replying saying, it's my birthday next week and I want to get this drunk too. And that's a really easy way to sort of summarise the fact that lots of the time we look at people getting drunk and we don't necessarily see it as a bad or harmful thing. We actually quite like it in some ways. And the really bizarre thing here is we can go to the NHS and we look at what the symptoms of being drunk actually looks like. So we will give you a list. And it talks about losing your vision, feeling sick, being dizzy, getting confused, having difficulty with understanding others, difficulties with coordination, potentially even losing consciousness. The really interesting thing here is that I'm not really actually showing you the symptoms of being drunk. These are the symptoms of having a stroke. But if you take the symptoms of being a stroke and put them side by side with the genuine symptoms of alcohol poisoning from the NHS, you'll find these symptoms marry really easily together. They're more or less identical. You can also compare it to oxygen starvation and you can compare it to mild head injuries. If you look down the list there, we've got much the same symptoms. Confusion, lightheadedness, dizziness, problems with balance, nausea, problems with your memory, concentration and blurred vision. The only difference here would be that nobody really wants a mild head injury, but lots of people do want to get drunk. So we have to ask if that's normal or not. And actually there's a lot of evidence to say it is normal. We know people have been drinking and using other substances for thousands of years, so we can go back into the archives and see evidence of this. What you're looking at now is actually a clay tablet found in modern day Iraq, depicting two people drinking beer. The two figures are on the left and the right, and they're drinking it out of a large jar in the middle, and they're drinking it through straws. So we know people have consumed psychoactive substances for many years for the purpose of getting themselves drunk or changing the function of their brain. We also know animals do this as well. The picture here is actually from a documentary with the BBC, where monkeys go to bars in the Caribbean to steal all the drinks from the tourists. And finally, we know that toddlers like to seek an artificial high. Obviously, they're not going to drink alcohol, but they love spinning in circles, so much so we'll build them roundabouts so they can spin round and start to feel dizzy and lightheaded. So it's definitely a normal part of development of some sort that at least some people, if not a lot of people, do want to feel intoxicated. So much so that it's actually in the drug strategy for North Yorkshire. You can see it there at the bottom of the screen. There's a sentence that says humans have always deliberately used substances and are programmed to repeat experiences that provide pleasure. Now the question is, if this is normal, what's the problem? Well, the problem isn't so much getting drunk. The problem is what happens when you're drunk. And to explore that, Reddit asks its users, what's the craziest thing you've done drunk? And this has been edited a lot to get rid of all the ones that we couldn't use. These are the clean ones. And they start with quite mild examples of people going online shopping and buying clothes they'd never wear sober. Someone says they thought it was a good idea to go for a swim in the ocean. Then we have someone doing backflips to impress the girl, and then it starts to take a dark turn. Someone kissed an ex, someone got punched in the face, and someone says, unfortunately, I drove a car. And the key word here is unfortunately. In other words, I wouldn't normally do this, but having had a drink, I felt it was okay to do it. And this is where it really starts to get a bit sinister. And we can look at this research from Newcastle University. They went to sit in an A&E department for a weekend to assess who was coming in and why they were attending A&E. And what they found was over the weekend, 70% of people attending A&E were attending with alcohol-related injuries and harms. There's a quote at the bottom here from someone who attended that weekend. He said, "It's embarrassing and I feel really ashamed. I've no idea how I got like that. I've never really been violent when drunk before, so I don't know why I lashed out that night. It's scary." Now, this guy felt so bad about his behaviour that he called the hospital and he asked to apologise to the nurse the next day. Now, we know that alcohol is heavily related to other extreme harms within society. So it's got a big role in physical assaults. 39% of all violent crimes in England are thought to have alcohol as a factor. A similar statistic for sexual assaults. It's obviously involved in drink spiking. It has a really complicated relationship with domestic abuse. Sometimes it exacerbates the abuse and sometimes it's a smokescreen. And then we've got drink driving, with 6,500 people killed or injured a year on the roads. In total, the government thinks about 1 in 5 UK adults are harmed by someone else's drinking, which is why it rates so highly on drug-related harms. Now, in terms of why this is happening, we need to explore the frontal cortex region of the brain and what alcohol does to affect that region of your brain. And to understand that, we need to understand what the frontal cortex actually does. Now, it's the very responsible part of your brain. It's almost like the adult part of your brain, supervising you and keeping you safe. So it will help you plan and organise, solve problems, control emotions, make decisions, and importantly, practice self-control. Now, what's really significant is that if we drink even a little bit, it will start to affect that region of the brain. It's the first part of the brain that's switched off by alcohol. Remember, this is a depressant drug, and this is the first part of the brain that is going to depress. And as it does so, we can see people behaving slightly differently. So at quite small amounts of alcohol, people will appear more relaxed, less inhibited, they might speak more loudly and gesture more as they lose their self-awareness. As the alcohol goes up, the behaviour changes a little bit further. So people may start to slur their speech, lose some coordination. And then after this, the alcohol will affect other regions of the brain. So we will see more extreme symptoms. So people start to get confused or disorientated, they may start being sick, and they may have some difficulty walking. And finally, at really high doses, there's a risk of death due to the parts of the brain being shut down that regulate your breathing and basically keep you alive. Most people don't get to that point, but about 10 people a week in the UK die through excessive alcohol use in this way. Now, what's really important to note is that most people who drink actually prefer to be at the lower levels here. These drinks tend to be more rewarding and less harmful. People don't want to get to the point where they end up being sick and unable to walk and potentially coming to harm. Now, what's really important in terms of how do people end up there and how do you avoid it, the best tip is to try and drink more slowly. And we have a little bit of advice which I'll go through really quickly, which is basically about eating before you drink, making sure you have a soft drink beforehand as well, and making sure you're not too stressed when you start drinking. If you're very stressed, you're likely to drink very quickly as a way of managing that stress. Within the first 3 drinks, ideally your second or third, you should have a soft drink just to slow down the rate at which you're drinking. And quite often after that, people may not want to resume drinking more alcohol. And the other thing is to look at the alcohol content of the drinks themselves. Often you can drink a lot less alcohol, even if you drink the same quantity, by taking a drink that's got slightly less alcohol content to it. But some people, of course, do plan to get drunk. That's why they're drinking. So they do want that higher dosage, but they don't necessarily want to get harmed or hurt. In fact, we can assume they don't want to get to that position. So we would say those people need to define the difference between being drunk and too drunk. There's always a too drunk. Ending up in A&E is probably too drunk. We'll talk about slowing down your drinking again. If you drink too fast, it's almost guaranteed that you are going to drink too much. We'll talk about having a plan for ending the night. This is about how you get home and where you're going to finish your evening. A sober friend can be really useful for this because they'll keep you safe, but also they'll get bored when they're around lots of drunk people, so they'll probably call time before it all gets out of hand. And finally, always skip your last alcoholic drink and drink water instead. That last alcoholic drink isn't going to do you any favours, it's just going to dehydrate you further while you're asleep, so you may as well have some water and start rehydrating, and it will help lessen your hangover in the morning. So it may be that we've resolved this question early on. We can say that how does alcohol use become misuse? We can say, well, not drinking too much. And as we remember from session 1, less than 14 units or 14 units under a week is the guidance. This would be okay. And maybe it's okay to drink more than that sometimes if you stay safe. But what's really interesting here is that people drink for different reasons. People drink to get drunk, but people also drink not to get drunk. They just have a couple of drinks every night, perhaps after work. We know who's most likely to end up in an A&E department. It's the person on the left who's getting drunk. But the question here is who's most likely to end up in a specialist liver unit? And actually it's the person on the right. We're seeing this more and more within the UK at the moment. People like Derek. Now Derek is in a video that we play in the live session of this module. We can't do it today in this video recording. It's available on YouTube. If you put British Booze Problem into YouTube, you'll find it. It's a documentary by The Guardian. The main thing to point out from this, and the reason we play it, is that Derek was only 43 when he experienced liver failure, but he wasn't drinking really high amounts and he wasn't getting drunk. He was actually drinking about 2 pints of lager a night, so 35 units in total. But he was doing this every single night. He ended up experiencing liver failure from that. Now, he was unlucky because this would actually not be within high risk drinking for a man. He would be an increasing risk category. And yet, he was actually quite vulnerable to the harms of alcohol and ended up with liver failure as a result. He is unlucky in that sense, but his story does get repeated in other places as well. So we find Phil's story on the NHS website, on the page about liver cirrhosis. He has a very similar story to Derek. He says, I'm not a heavy drinker, I had a couple of pints after work, and he didn't know there were any problems until he had some pain under his ribs and started vomiting blood. We find something similar again on the British Liver Trust. We find Emma's story there. She didn't consider herself to be addicted to alcohol. She's just drinking quite high amounts of it and ended up with liver failure. And then we can look at a study from the University of Nottingham. Now, this was a study looking at liver cirrhosis. You can get liver cirrhosis through other factors, but the most common is through alcohol, and that's what happened to Michael, Mary and William, all of whom took part in that study. They had similar stories. So Michael said, I was just an everyday social drinker. Mary's going to the pub after work. William was having a drink after work. Before they had liver cirrhosis, they would never have identified themselves as having a problem with alcohol use. And that's really significant because you kind of think, well, how can you be drinking at a level that's doing such significant harm, but you don't realise this is happening? Well, there's a couple of things to bear in mind here. The first is about individual susceptibility. We're all susceptible to alcohol harms to a different degree or other. It's not universal. So for instance, we can compare Derek's story, where he had liver failure at 35 units a week, to Winston Churchill's drinking. He was drinking monumental amounts, 175 units a week. He would have a pint of champagne with his lunch every day, a pint of champagne with his dinner. He'd have whiskies and sodas through the morning, wine and brandy at other times as well. And yet he lived until he was 90. Now we don't know why he was so resilient to alcohol harms and Derek was so vulnerable. And the point is that you won't know yourself what your level of harm is either. We can't test for this in advance. We can only test for harm as it happens. And if you are harming yourself, you might not realise you need to go and get a test. That's because most of this damage is symptom-free. We know about 80% of diagnoses of liver failure occur in A&E after gastrointestinal bleeding. So people don't go to the doctors, they actually get that bleeding and go to A&E, and that's where a diagnosis is made. Now they don't get an internal cue to change before that. For most people, they don't get pains or symptoms that tell them they're drinking too much. The other thing to bear in mind is they don't get an external cue to change either, and that's because we've normalised the use of alcohol. What they're doing isn't unusual, or potentially something we see as risky, and that's something we've explored already in Module 1. If you remember back to that, we looked at how drinking in the UK has changed. It used to be that you went to a pub and you drank in the pub, and this was very much the pattern in 1970. But from 1970, this has been changing, and today more and more of us are buying our alcohol in supermarkets and drinking at home. And actually we're drinking a lot more. And the interesting thing here is we can overlap this graph for this session. And this shows you the cause of deaths for under 64s in the UK over the same time period, and the things that people are dying from in middle-aged. Now there's a lot of good news here. You can see a lot of these charts, these lines are going down. Those represent diabetes and heart attacks, diseases like COPD and cancers. We're getting better outcomes for all those things. But there's this line here that's going up, and this represents liver disease. Deaths from liver disease in this age category have increased by 400% over this period of time. And that's very much related to how much alcohol we're drinking. And again, people don't realise the harm that's happening as they drink. Now to understand this and what's happening, we need to take a look at your liver. Now the liver is an organ that will help clean the blood. And if you drink alcohol, it will turn alcohol into acetaldehyde, which is this compound here. Most of us won't have heard of it, but we might have heard of a very closely related compound called formaldehyde. It's very similar as a substance. Formaldehyde is used in laboratories for preserving animal specimens. It's very good. In fact, it does hold metabolic activity. So that's very useful if you want an animal specimen to stay in one piece and not break down. But you want metabolic activity when you're alive. So this is not a useful substance to have floating around your body. However, a healthy liver can metabolize it further. It will turn acetaldehyde into an acetate and then into water and carbon dioxide. And it will take about an hour to do this to a unit of alcohol. So in other words, it will take you 2 or 3 hours to break down the units in 1 pint of beer or a medium-sized glass of wine. Now a binge is when you drink alcohol faster than the rate at which your liver can process it. And technically, for a man, that's anything over 8 units or about 3 drinks in under 2 hours. Or for a woman, it's anything over 5 units or about 2 drinks in under 2 hours. So if you're drinking faster than that, technically this is a binge. And when we're binging, potentially we're going to be creating harm for our livers, particularly if we do this regularly. Now, a liver doesn't go from a healthy liver to liver failure in one go. It goes through certain stages, and we can chart that quite accurately. So the first thing to happen is someone would have a fatty liver. This is where the liver creates fat from the extra calories and alcohol. It doesn't seem to have any symptoms. You wouldn't necessarily know you have a fatty liver, but this is the thing that we could do a scan for and see and understand from that. Then the liver will become inflamed. Now we see this in young binge drinkers or older long-standing drinkers. It's alcoholic hepatitis. And then we get cirrhosis. Again, if someone continues to drink at this rate over a long period of time, This is when the liver starts to get scarred, and we can see this very clearly on a liver scan. It starts to get jagged around the edges, and its texture changes as well. Instead of being soft and spongy, it becomes hard and woody. Blood can no longer flow through it so easily, so it will actually get forced around it into smaller blood vessels that can't cope with this volume of blood. And often they bulge. We call those bulges varices, and if they burst, that's often when someone will start coughing up blood, and that's why they go to A&E. Now the good news is the liver can repair itself. So if you stop drinking, a fatty liver can go back to a healthy liver, and alcoholic hepatitis as well can resolve itself when you go back to a healthy liver. Cirrhosis of the liver tends to stick around, but it will stabilise. And actually, if you stop drinking, the outcomes here can be really good. And we know this from a particular study that was done looking at survival rates for people with liver cirrhosis. They said that actually what they were surprised at in this study was that survival didn't necessarily depend on how severe your cirrhosis was. It was more about whether you stopped drinking or not. If you stopped drinking, the outcomes were really quite positive. Which takes us here in terms of how hard is it to do that? How hard is it to stop if you're in a habit of drinking really high amounts? Now the surprising thing is, for many people it's not as hard as we'd imagine. We've got a story here of Ben Anderson. He's a producer for the Over the Influence podcast. He says that he's accidentally alcohol-free. He didn't intend to give up drinking. He was just producing this podcast. And he heard so much about being alcohol-free, he decided to give it a go for a few months. And he had been drinking quite a bit. At this point, when he wrote this, he said it was 2 years later. He said he can look back with hindsight and say it's one of the best things that's ever happened to him. He's now, I think, 4 or 5 years drink-free. His story is very similar to the co-host on that show, Sharon Hartley. She also really enjoyed drinking. I think she was about a bottle of wine a day at the time. And then she felt that she wanted to stop, just briefly, to take a break from alcohol. She was going to take a 90-day break in September 2018, and she's still drink-free today. She just found that life was a lot better when she stopped drinking, and she's never gone back to it. And these stories aren't exceptions. There's lots of people who experience this, drinking high amounts and then stopping without seemingly too much effort. Kate Gunn wrote a book about it called The Accidental Soberista. She was supporting her partner to quit. This person got COVID, this person ran out of money, and this person took part in Dry January and just never went back. And then finally, we've got this person who forgot to buy wine. She actually says in her article about this that she really enjoyed drinking. It was a big part of her life. Barely a day would go by when she wouldn't have a drink, and then she went on holiday to the Highlands and forgot to pack any wine, and there were no shops nearby, so she had to go without. And once she went without, she found she didn't miss it in the way that she thought she would do, so she just stopped. Now, for those of us who are aware of addiction literature and everything that's been written about alcohol issues, that's a bit curious, because we would think, why is that happening and how can that be happening? Because what we're told about addiction is that this is some form of disease, or it's a disorder, or it's something about your personality, or it's in your genes, or it's hereditary. It's certainly not something that can just be turned off so easily. But for some people it can. And to explain that, we're going to go back to this. Again, this is the diagram showing you how many people drink. In England, 82% of people do. What we're going to look at now is how many people drink at high risk levels, increasing risk levels, and low risk levels. Now, surprisingly, for many people, this is maybe different to what they expect. Most people actually don't drink above guidance levels. They drink at low risk levels. Then we have 25% of people who are drinking at increasing levels. This would be people like Mary, and 5% at high risk levels. Now the point is that it's that 25% who are drinking at moderate levels to high levels who are being harmed in the highest number of numbers, just because there's so many more of them. It doesn't necessarily mean they're addicted or they've lost control of their alcohol use. They're just in that higher category and they're drinking enough to cause themselves serious harm. And actually these are the people we're most frequently seeing with serious harm. Now the most serious harm is still that minority, that 5%, the red part of the pie chart. There's just a lot fewer people there. And that's really interesting, because there is a difference between drinking too much and being addicted to alcohol. You can drink too much and not be addicted, and we're going to explore addiction a bit later on. In the meantime, we're going to look at an example of someone who was definitely drinking too much and would fit into this category. This is Adrian Charles. We mentioned him in the first session. He's made a couple of programs about alcohol use, and the other one we talked about was Panorama, where he looked at drink labeling, but in this one, this was from a program called Drinkers Like Me. This is a kind of breakthrough program for him in which he explored his own alcohol use. And the little still we've taken here is of him filling out the Drinkware app the day after he'd been drinking at a friend's 40th birthday party. He found out that he drank 4 pints of Guinness, 4 bottles of beer, a glass of champagne, 5 glasses of wine, and when he put all that into the app, this totaled 32 units, over twice the weekly amount that he would have been recommended to be drinking. In total for the week, he was actually over 100 units, and he's written a book about this since, saying this is how he would drink week after week for years after years, pretty much since a teenager. Now, as of today, he's drinking about 20 units a week. That's still within the increasing risk category, but he says he's happy to be there, and he doesn't feel he needs to cut down much further than that. He thinks this is a good compromise for him. And he challenges the idea that everyone who drinks too much needs to stop, because maybe some people feel they can't, or maybe some people feel they don't want to. But he'd still encourage those people to try and cut down. He points out that the difference between cutting down from 50 units to 30 units is really massive. And to demonstrate that, we're going to go back to this chart here. We're going to take two slightly different data points. We'll look at 70 units, reducing from 70 units to 35 units. So even if you reduce to 35 units and you're still drinking half a bottle of wine a day, that's the equivalent to that. If you've cut down from a bottle, then actually you've extended your life expectancy by about 5 years, which is greater than the increase in life expectancy you'll get from stopping after that. It could still be worth doing that, but you'll actually get most of the benefit earlier on. And this becomes more dramatic with the higher amounts of alcohol someone's drinking. What we tend to see is the higher amounts of alcohol someone's drinking, the less motivated they are sometimes to change because they feel it's too hard and it wouldn't necessarily be something that's possible for them. So what we would say is, well, if it's possible to get down to a bottle of wine a day, if you're drinking, for instance, almost a bottle and 3/4, if you can make that transition and you continue drinking a bottle of wine a day, but you don't go back up again, then your life expectancy will actually increase by about 14 years on average. So in other words, instead of dying at the age of 55, you'd potentially be dying at the age of 69, which is still prematurely, but it's much better than it was. So we'd encourage people, anyone who's drinking, to think about cutting down if they're above low risk levels. And any reduction is beneficial, and this becomes more beneficial the more that someone is drinking. Now, in terms of how people can do that, there are some different resources to have a look at, and we actually cover this a lot more in the third session of this series. The first thing is to find some podcasts. You can go to your podcast player and put in the word alcohol, and you'll get a big choice of different podcasts to listen to, generally run by people who've had issues with alcohol use. The one that we referenced today is Over the Influence, and that's not a bad starting point if you want to check one out. You can also take a look at books. If you go to Google and type in the phrase quit lit, short for quit literature, click on books and you'll get a wide selection of books to have a look at. And again, this is something we look at a lot in session 3 if you're interested. Then there's some other steps you can take to change your use. We've already discussed the Drinkware app. The other apps are available. This will really help you track your drinking. We know people who tend to do that tend to reduce their use as a consequence. You can swap your drinks as well. We've got a resource on Drink Drug Hub there, which will take you through to the alcohol-free shop and give you a really big selection of drinks to try that don't contain alcohol. And the final thing is people could take a break. We know that if people take a break, they tend to drink less as a result afterwards, and this tends to be a long-term change. The only exception we would make here is if you're physically dependent, and then we'd say absolutely don't try and take a break. You will know if you're physically dependent if you feel like this when you stop drinking. So when you stop drinking, you feel sleepless, you have headaches, tremors, shakes, you vomit, you have high levels of anxiety, you sweat a lot and you have no appetite. These symptoms tend to start within 8 to 24 hours of your last alcoholic drink. In extreme cases, people can present as confused and agitated and even hallucinate. This would be called delirium tremens. It's a very serious condition. If someone is presenting like that, they need to go straight to hospital. In 1 in 10 cases, people can experience seizures, and very rarely but sometimes these can be fatal. This means that if you experience withdrawal symptoms when you go without a drink, we'd say don't take a break, but go and seek medical advice before trying to stop. Now we take a look at this again in a lot of detail in Module 3. So we'll look at how people can stop drinking when they're physically dependent there. The other problem you may have is actually you have a psychological addiction. That means that you try and stop drinking, but you're unable to. So your drinking resumes, or when you try and limit your drinking, it runs away and you drink more than you intended. You will also notice you're experiencing negative consequences from your alcohol use, and yet you're unable to change it as a result. These would be very typical signs of addiction. Now you can tell if you're addicted because we do have a really useful tool to look at that you can use to judge this for yourself. It's called the Alcohol Use Disorders Identification Test. It's the screening tool your GP will use if you go and see your doctor and they identify drinking as a potential issue. It's 3 questions long. It asks you how often do you drink, how much do you drink, and how often do you drink too much. Your maximum score here is 12, and if you score over 5, this is seen as a positive screen. In which case you would do the full screening tool here, which is 10 questions long. So this adds questions about whether you're unable to stop drinking, if you drink in a way that gets in the way of your life, if you drink on a morning, if you're guilty, if you have memory problems, if you or anyone else is injured by your drinking, or if other people are worried about your drinking. These would be all things that you would score against. And your maximum score here would be 40, and anything above 16 would be considered the threshold where treatment would be worth considering. Now you can actually take part in that tool yourself through Drink Drug Hub. We've got it linked to the website, and you click on that icon there and it will take you to that resource to answer those questions, and it will give you your own score. You can also refer other people for that. In terms of how people have ended up in that position, there are different schools of thought. Some people think it's a disease, and that means it might be something that you're born with or that has developed over time as you've been drinking. But there are other ideas as well. This could be about genetics, your personality, the life experiences you've had, your social conditions, or it could be a learned behaviour. And these are the 2 models that really shape alcohol treatment within the UK. It's either people perceive it as a disease, in which case they talk about it as a chronic and relapsing condition. Again, this could be something you're born with. It might be something that develops over time, but ultimately it says that you won't have any control over your alcohol use, and the only cure is to abstain completely. The learnt behaviour model is slightly different. It's a slightly more modern model. It says this is a behaviour that you've learned through lived experience. In other words, if a behaviour is rewarding, you're likely to repeat it, and if you keep repeating it, it will become entrenched until it becomes automatic. Importantly, it says some people can regain control through therapeutic work, although some may still need to abstain. So for instance, if someone is pregnant, the recommendation would always be that someone should abstain on that basis. Now, what you'll find is the disease model underpins the work of organisations like Alcoholics Anonymous, while the learnt behaviour model underpins the work of organisations like North Yorkshire Horizons. So we would use this intervention here, the Alcohol Pathway Book. It's a CBT-based model to treat addiction. And in doing so, it works on that prefrontal cortex that we've already mentioned. Now, this is starting to talk a lot more about support that you can get around alcohol use issues. And you can get that through North Yorkshire Horizons, and if you're a young person, you can get it through NY Rise. If you're not within North Yorkshire, you can find your local service through Frank. And again, we have all this listed on Drink Drug Hub. But if this is you, you might start finding you have lots of questions to ask about what happens when you attend drug treatment services. And you can see those populated on the screen there. What I will say is these are all questions that we tackle in the final module in this series called Getting Better, and that's available to book now. In the meantime, this is the learning summary for today. The first thing would be to say that alcohol can harm people who drink heavily in one session or drink smaller amounts frequently. This latter group are the people who often get harmed without realising that the harm is occurring. The second thing is that drinking too much and being addicted to alcohol can be 2 different things. People who drink too much but aren't addicted can often cut down by following a few simple steps. The more you drink, this is the third point, the more you drink, the more you can benefit from cutting down. And that is true even if you keep drinking above the recommended guidance levels. Meanwhile, if you struggle to manage your alcohol use or feel ill without a drink, This could be a sign of addiction or dependency, and you can do an assessment around that using the audit tool available online and also linked to Drink Drug Hub. That will indicate whether you should seek formal support. And if you want to explore formal support as well as all the other support that's available, including podcasts and books and social media groups and drink coaches, then you can find that in the third and final module in this series called Getting Better. You can book a live session through Drink Drug Hub to attend that, or another recording of the session will be along soon. Thank you for attending today.